If your lower back hurts way down low and only on one side, I want you to listen closely, because what you are feeling is probably not what you think it is. Most people assume it is the spine, a slipped disc, a pinched nerve, something serious. But very often it is none of those. It is a small joint right at the very base of your back that has simply gotten stuck. Today, I am going to show you how to tell if that is what is going on, and 4 gentle moves you can do today on your bed to help it settle. Most people have never even heard of this joint, and yet it is behind a huge share of one-sided low back pain. One honest word first. If your pain shoots below the knee, or there is numbness or real weakness in your leg, do not do these moves. That is a get checked sign. And if you already have a back diagnosis, please run this by your doctor first. Welcome to Health Mile. If this is helpful, please hit the like button and subscribe to our channel. We bring you practical, science-backed health guides every single week. And tell us in the comments, which city are you watching this from today? So how do you know if it is this small joint and not your spine? 5 clues. First, the pain sits low, right down at the base near your belt line. It does not climb up your back. Second, it is on one side only, just the right or just the left. It does not cross the middle. Third, it can travel into the buttock or the back of the thigh, but it stops above the knee. It does not run down into your foot. Fourth, it flares when you stand up, getting out of a chair, climbing out of a car, going upstairs. And fifth, this is the one people always nod at. It eases off when you lie down. Lying flat, and it settles. Sound familiar? If you are nodding along, there is one more simple test. Stand up. Put your hands on your buttocks right over the sore spot and gently lean backward. Arch back slowly. If that reproduces your pain right there at the base on one side, that is your answer. Now do me a favor. Tell me in the comments which side is yours, left or right. I read every single one and it helps more people than you would think. Now, let us look at why this happens. The muscles around your buttocks, left side and right side, start pulling with different tension over time. One side gets tighter than the other. And that tighter side gradually turns one half of your pelvis a little forward relative to the sacrum, the bone right in the center. That small forward rotation is exactly what jams the joint. That is the whole problem. One side rotated forward and stuck. The good news is we can work on it directly. These 4 moves rebalance the muscles around the pelvis so the bones can settle back where they belong. Move 1. The block squeeze. You will need something firm to squeeze between your knees. A yoga block, a thick hardcover book, or even a firm plastic food container all work well. Lie down on your back, bend your knees to about 90 degrees, and place the block lengthways between your knees. Keep your heels together. Now give that block a firm, steady squeeze for 10 seconds. Do not be surprised if you hear a small click or pop in the pelvic area. That is completely normal. Just the joint releasing pressure. After 10 seconds, take a deep breath and relax fully. Then turn the block to its narrow side. This shifts the focus to a slightly different set of muscles. Give it 2 to 3 more squeezes, holding each one for 10 seconds with a full relaxation in between. Move 2. The single knee pull. This one is done on the sore side only, not both sides. Stay on your back. Reach down with both hands and draw the knee on your sore side up toward the shoulder on that same side. Not straight to your chest. Aim it toward the shoulder. The effect happens right at the very end of the range. Pull it as far as it comfortably goes, give a gentle extra tug at the top, hold for 1 or 2 seconds, then ease off. Do that 15 times. If you compare it to the other side sometime, you will notice the difference immediately. The good side pulls up easily, while the sore side feels tight and hits a wall early. That tightness is exactly what we are working on, which is why we leave the good side completely alone. One caution. If you feel sharp pain in the groin as you pull, stop this move immediately. That sharpness means the hip joint itself is involved, and this particular move is not right for it. Also keep the other leg down flat on the bed throughout. If it keeps rising, have someone gently hold it down for you. A helper can also press lightly on top of the pulling knee to deepen the stretch slightly, but stop the moment anything feels sharp. 15 slow pulls, coaxing that forward-rotated pelvis back where it belongs. Move 3. The stick press. Grab a firm stick, a broom handle is perfect, or a wooden dowel, a rolling pin, anything firm and solid. Nothing floppy because you need something to push against. Lie on your back and pass the stick between your legs up close to your knees. Lift your legs to a right angle and hold the stick firmly with both hands so it cannot slip. Now press your legs outward against the stick like a pair of scissors trying to open. Push out and hold for a count of 10. Then fully relax. 5 repetitions on this side, then switch your legs so the other one is on top, and press again 5 times. This is a quiet but powerful move. It balances the tone of the buttock muscles on both sides simultaneously. That side-to-side balance is half the battle in keeping this joint free. Move 4, the asymmetric bridge. This one is on the sore side only again. Let us say the left is the sore side. Lie on your back and reach up to grab the good leg, the right, with both hands, pulling it in toward you. Your arms and that bent leg form a triangle, and that triangle anchors and steadies your entire body. Now, bring the sore leg's foot in close to your buttocks. Holding that triangle firm, lift your hips up toward the ceiling. Then come down slowly, barely touching the bed at the bottom, and immediately go back up without letting the muscles switch off. Reach the top, hold for 1 to 2 seconds, then lower slowly again. 5 times through. If it feels manageable, work up to 10. The key is the form. The lift comes from the hips, not from yanking with the arms. Slow up, slow down. This is the most challenging of the 4. If it is too much, or if you have been told you have osteoporosis, do a smaller lift or skip this one entirely. There is no reward for pushing, and if your body shakes a little, that is the muscle finally waking up. Just never force it into sharp pain. That is your complete routine. 4 moves. Now let me answer the questions I know are coming, because I have heard them hundreds of times. First, it felt worse afterward. Did I do something wrong? Usually no. A little muscle soreness after new movement is normal, like any muscle that has not been used in a while. But there is a line. Achy and stiff is fine. Sharp or shooting pain is not. That is your signal to stop. Moving gently is good. Forcing is not. Second, what was that pop? That sound can be startling, but it is simply gas bubbles releasing inside the joint fluid. Exactly the same as cracking your knuckles. It is not bones grinding. And importantly, the pop is not the goal. Many people get completely better without ever hearing a single sound. Do not chase it. Do not twist or crank your back trying to force a crack. These moves let the joint settle on its own terms. Third, are you sure this is not a slipped disc? A disc problem typically sends a sharp electric pain all the way past the knee and into the foot, often with numbness or the leg giving way. This joint's pain stays high on one side, above the knee. If your pain shoots below the knee, if there is numbness or weakness in the leg, or any difficulty controlling your bladder or bowels, stop and get seen immediately. Do not wait on that. Fourth, how do I keep it from coming back? Stop sitting cross-legged the same way every time. Switch it up. Remove the wallet from your back pocket. Swap the shoulder you carry your bag on. And after these exercises, do not spring straight up and rush off. Give your body a quiet minute to settle. Small habits, but they are what keep the pelvis level over time. Fifth, I am older, I have arthritis, years of back problems. Is this okay for me? Age by itself is not a reason to avoid gentle pelvic stabilizing exercises, and physical therapists frequently recommend exactly this approach for this type of pain. But you know your own body. If you have a specific diagnosis or anything feels off, check with your doctor and let them tailor it to you. Go slow, use your hands for support, and there is absolutely no prize for rushing. And finally, how long until it works? Be patient. Twice a day for 2 to 3 weeks. Not once and done. And here's the part people skip and later regret. When the pain eases, do not stop. The pattern I have seen over and over is that people feel better, quit the routine, and the pain quietly creeps back. Keep going a little longer than you think you need to. Let the improvement stick. 4 gentle moves, twice a day, 2 to 3 weeks. This is not a replacement for your own doctor. If anything is unclear or feels wrong, get it checked. But for one-sided low back pain that fits the pattern we described, this is a sensible, gentle place to start. Tell me which side is yours in the comments below, and please hit the like button and subscribe to Health Mile. We post practical health guides every single week. Take good care of yourself. See you in the next video.